to imagine something. You agree? Imagine we live in a world where we can detect cancer before it becomes too dangerous. Imagine a world where we have the tech to do that. Imagine a world where we can monitor our own blood pressure, blood sugar, oxygen levels, and maybe even perform ECG from the comfort of our own homes. Imagine personalized medicine can tailor treatments for you, specifically for you. Imagine a world where longevity is not that unachievable. Well, we live in this world. This is our reality right now. We're living it. We live in a world with rapid innovation, with visionaries driving advancements in tech, in finance, and sustainability. AI is now transforming healthcare, medicine, nutrition, transportation, with smarter tools and predictive tools, making everything more precise and more efficient. AI tools and AI algorithms nowadays can actually accurately detect cancers and detect heart diseases and cardiovascular issues in people, while our smartwatches and sensors that we wear track our health real time. Well, we have it all, don't we? Do you think humanity have been there before? I don't think so. I also don't think we appreciate it as well. I don't think we understand it as well. But here is the irony. There is that big, oh, but. Despite that endless innovation, rapid innovation, we still have an alarming rise in diseases like obesity, cancer, and other non-communicable diseases. The Global Burden of Disease survey in 2019 showed us that worldwide, half of the population and even obesity rates doubled since 1919 for adults. And for adolescents, it's quadrupled. I think that's concerning. In 2022, the Global Federation of Obesity published a number. The number was 2.55. 2.55 billion people around the world are being overweight right now. Maybe the number even drastically changed in 2025. And 890 million of those people are living with obesity right now. It's not even the worst, is it? Cardiovascular diseases are still the leading cause of death. So what are we doing wrong? Where is the problem? We must address the paradox. Because if we do not address that paradox, there is no such tech and no such innovation that can be useful for us if we keep those numbers rising. In our quest for innovation, in our quest to resolve problems, I think we forgot and we might have overlooked one specific stage. That exact stage where we still don't have those problems. We still don't have those conditions. Sure, we've made some incredible scientific strides along the way, but we've also managed somehow to build lifestyles that work against us. I'll try to explain, I promise. We live in a world of abundance. At least that's my theory. We live in a world of abundance. We have access to food 24/7. You don't even have to get out of your house to be able to access food. You can order food one click away. You can get food one phone away. Maybe there's a faster way as well now that I don't know, but it's fast. Our physical activity levels plummeted. We no longer move. Actually, myself and probably most of you here have to arrange a specific schedule and time for yourself so you can do some physical activity. Why are we acting like this is normal? Historically, physical activity was such a natural thing in our lives. I see it as a problem. There is one more thing that is in abundance. Can you guess? Information. We have an abundance of information. So much information that we actually struggle detecting which one is a misinformation and which one is the right information. People are getting confused. We have everything, but we are more confused than ever now. We live in a world where people started fearing food. We live in a world where people think that eating a piece of fruit after a meal may cause damaging things in your stomach, fermentation in your stomach. We live in a world where people think that single foods such as apple cider vinegar or maybe celery juice can do miracles in terms of nutrition. Funny, isn't it? No one is laughing though, because that's actually not funny. That's tragic. Because people started doing things crazy enough to actually cause issues to their health. There is one more thing. Product endorsements. All that influencing products, all that promotions we see, it seems they're mostly led by financial incentives rather than scientific evidence. The worst thing is, healthcare professionals like myself and medical professionals, even they can fall victim to things called like confirmation bias. Reinforcing misconceptions instead of challenging them, instead of dissecting them and analyzing them critically. We are there now. Somewhere along the way, we've become so obsessed with fixing things that might not need fixing at first. General population started fearing food groups like lactose, dairy, carbohydrates. Oh my God, who's even consuming carbohydrates? Duh. The thing is, people are not being assessed individually so they can see whether they need to exclude something from their diet, whether this is a medical need, whether there is some kind of intolerance that make you stop such food. And by doing that, uninformed, unconsented sometimes, they don't realize that actually this can cause nutritional deficiencies in their body. Nutritional deficiencies that can potentially also cause negative health outcomes. I am pretty sure people don't realize it. And this is again linked to misinformation, again linked to that product endorsement, promotion of ideas, us being victims of confirmation bias. Do you know what confirmation bias is? Confirmation bias is when a specialist, like let's say myself, believe in something and only looks at research that is proving that something. This is not critical justification though. Well, what do we do? How do we move further? The fundamentals of good health don't need to be that complicated at first. We can start by moving more. Our bodies, they are not made to sit on a chair for 8 hours, maybe some of you even more, with our lifestyles. So start moving. Second, maybe eat less. I just wanted to see your faces, honestly. I just wanted to see your faces. No, don't eat less. Please do not do so. Malnutrition is an existing issue in our planet. Eat more from the right food. Eat more whole foods instead of eating ultra-processed and high-energy, energy-dense foods. Eat more legumes. Eat more whole grains. Eat more vegetables. Eat more fruits. Eat more lean protein. Eat more plant-based protein. Healthy fats. I'm pretty sure you all know that. But also, don't forget to add enough fiber in your diet. You have to get at least 30 grams of fiber a day. I challenge you, when you go back home tomorrow, try to track how much fiber you take. Probably you don't take enough because the population in our world is seen to be not taking enough. I want you to have the challenge with me. What if, instead of focusing on innovation and the latest advancements and the latest things that pop in, we go back, a step back maybe, and we start focusing on the core. We start focusing on the basics and start doing and implementing small changes in our routine that can help us. I know the pursuit of longevity sounds exciting. The world of science is looking at it. Everyone is looking at it. Scientists and people in science and research, they now try to find a link between how supplements maybe keep us alive for longer. They do that. It's really interesting. But longevity is meaningless if we don't have quality of life. In some fields like gerontology and, let's say, preventive medicine, science proves us that our lifestyle choices can make a big, big, big difference. Not to forget. What else we can do? Here's what we can do. You need to learn to slow down. We have to slow down. We're so fast. We have everything. We can do anything. We have all the tools. We forgot to slow down. You might try to incorporate something called NSDR. Have you heard of it? No. No sleep, deep rest. No sleep, deep rest is a term and a performance thing coined by someone called Andrew Huberman, who is a doctor in neuroscience. This thing can help you release the stress and relax the nervous system. It is a breathing technique. I would encourage you to take a look. As I said, longevity is meaningless if we don't have the lifestyle. What I mean, here is what I mean. There is those two pictures that you see right now, right? If we start putting bricks, as in the first picture, if we start putting only one brick down there, and then maybe start putting other bricks on top of that, do you think that wall will be stable? No, it will crumble down. And once it crumbles down, what we're gonna do is we're gonna find a probably better solution, maybe a better sticking material, so they can be better sticked and the wall is stronger, maybe a better glue or whatever, you know. This is called reactive approach. So we ruined something because we didn't start it as we should, and then we are trying to fix it reactively. Wrong. If we only focus on what is really needed, like maybe starting to build the core. Eat better, have balanced diet before saying, oh, I should exclude this and that. Let's make sure what's included is enough. And then start moving more. 20-minute walk? Right, something better than nothing. Maybe tell yourself, if you're working in an office, tell yourself, every 50 minutes, I will try to stand up and do something for 10 minutes, which will help me. By the end of the day, you have 60 minutes of physical activity that otherwise you wouldn't have. So, build a course. Change the narrative. Instead of focusing on what to exclude, try focusing on what to include, because we are missing so many things. Build the core. Don't be reactive. Be proactive. Prevent rather than treat. And eat healthy. Thank you.